Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing clinical aspect of Rasa Vichar and we have completed Katu Rasa in that regards. Today we will move to the Tikta Rasa. The composition of Tikta Rasa is Vayu and Akash Mahabhut. And the Lakshana mentioned in the Ashtanudaya Tikto Vishadeti Stastam Rasanam Pratihanticha. So, Vishada, it means it makes the mouth clear. Vishadayate Asyam, it makes the mouth clean and clear. Now, it is Vayu Akash Mahabhut. So, Lagu Guna and mainly Ruksha Guna of Vayu is present in the Tiktaras. So, by the rule Shoshane Rukshaha, it cleans all the secretions in the mouth. So, whenever there is excessive salivation, especially in the diseases of parotid gland or in small babies, the Tikta Rasa is very useful. It is another function is Rasanam Pratihanti. We know Tikta Rasa is bitter to taste, so when we eat Tikta Rasa, it hampers all other taste sensation. So where we can use it? You can use it in the diseases like Bhasma, there very heavy, excessive hunger, and patient eats in that Bhasma Roga continuously. So if the taste is hampered, we can control automatically the quantity of food. The next is all the Kaphaja diseases like Medorog, Staulya, Prameha, where this Rasanam Pratihanticha can be useful to control the excessive food consumption and to have control on the food quantity. So, Vishadayati Asyam and Rasanam Pratihanticha, these Lakshana can be useful in the case of Tikta Rasa clinically. When we move to the functions of Tikta Rasa, the Ashtanudaya has stated the first line, Tiktam Swayam Aruchishnur Aruchim Trumitrud Visham. Now we have said Rasanam Pratihanticha as a Lakshan, and on the same next line, the Granthakara has explained that it is Aruchi, in Aruchi Tikta Rasa is useful. So how it can be possible? We will come to it at this point little bit later. We will discuss about the other functions at present. Tiktam Swayam Aruchim Krumi Trud Visham. Now Krumi, the main cause of the Krumi in the body is Kapha dosh, which is the proper environment for the growth of the Krumi. And in Krumi Chikitsa, they have mentioned 3 steps by Charaka Samhita. First, that this environment which is good for the growth of the Krumi, like Kapha, it should be taken care of. Then Krumigna, and then Krumi Rechana, the Krumi which are living or non-living in the body are to be thrown out of the body. Now, in these 3 factors, the first one, the Tikta Rasa is again Vayu Akash, so it is Kaphagna. So, it will be useful to reduce the Kapha dosh in the body, which is providing a suitable environment to the growth of the Krumi. See, Tikta Rasa is of Shita Virya, so it is hardly Krumigna because Tikshna and Ushna Guna are mainly useful for the Krumigna purpose. So, by reducing the Kapha dosh, the Krumigna action of the Tikta Rasa takes place. Krumi Trud Visham. Now, Trud means Trushna. Just in the Lakshana, we have discussed that it is Shoshane Rukshaha. It absorbs all secretions or water content. So, how we can be useful? It can be useful in the Trushna. Now, I will give you examples of 2 patients. this is a month of May, there is severe heat outside, and a person, or we can feel the hunger, thirstiness in that excessive heat. This is a Trushna. And second is a patient of Jwara. He is having high grade fever and he is feeling the thirst. Now, in these two conditions, thirst is the same Lakshana in the two persons, but cause of first one is because of excessive heat, Ushna Guna is increased, and this Ushna Guna has absorbed all water content, and that's why there is thirst. So in that case, we use water in that excessive water for refilling the water content in the body. In the next case of Jwara, there is Amanirmiti, and hence the Trushna is Amaja Trushna. Tiktaras we have discussed in Dipan Pachan when we have discussed this karma in detail, that Tiktaras is a Shrestha Amapachak Dravya, and hence the indication of Tiktarasa in the Trushna is specifically when there is Amaja Trushna. So when the Trushna is because of Ama, like Jwara, Udara, Tiktaras is indicated, and when Trushna is because of Pitta Vruddhi, like summer season, Tiktaras is totally contraindicated, because in that case by Shoshne Ruksha rule it will again decrease the water content which is remaining in the body. So Tiktaras is useful in only Amaja Trushna. Now let us come to the Aruchi point. We have seen that in Katurasa also it is Ruchikara, and Tiktarasa is also useful in Aruchi. Composition of Katuras is totally different, and that of Tiktarasa is also different. Now both these rasa are useful in the same disease, Aruchi. What will be the line of action, or what will be the difference between the action of Katurasa and action of Tiktarasa, and accordingly in which diseases these two rasa are indicated specifically in the case of Aruchi. We will discuss this point in the next episode. Thank you very much.